Well, good morning, y'all. It is sure good to be back home in Wilcox County. For the last 2 weeks, the men and women of the Alabama National Guard have been rotating throughout rural counties around the state to administer the highly effective COVID-19 vaccine. Today, Dr. Harris, Dr. McIntyre, and I are here at one of those clinics here at Wilcox Central High School. In Alabama, we plan to use every tool in our toolkit to put an end to COVID-19 once and for all, and no doubt, the Alabama National Guard is a critical part of this effort. Our goal is simple, and that is to get shots off the shelf and into the arms of Alabamians. In the first week of these mobile vaccination clinics, while competing with severe weather, our guardsmen set up shop in 7 counties, administering more than 3,000 doses of the COVID-19 vaccine. Between last week and what we have going on so far this week with the National Guard mobile clinics, more than 7,000 shots have gone into arms, and bad weather was once again a factor. Folks, this is progress, but we certainly want to do more, and I'm confident that we can do that. I've committed to the people of Alabama that we're on a path forward, and I remain hopeful and optimistic in where we're going. To that end, I'm announcing that every Alabamian 16 years of age and older will be able to receive the vaccine starting Monday, April 5th. This vaccine is our ticket back to normal. And y'all, we're getting so close to getting COVID-19 in the rearview mirror. And until then, we need to keep wearing our mask, use common sense, use personal responsibility, and use your common sense that the good Lord gave you. If you're currently eligible for the vaccine, I encourage you to come out here to Wilcox Central High School, or if you live in or near Russell County, you can visit the Chattahoochee Valley Community College. These clinics are open today from 9 until 5 p.m. Next week, the Guard will be in Butler, Washington, Crenshaw, Monroe, Clark, Pike, Barber, and Conecuh counties. So y'all please take advantage of this great and easy resource. It's very much a community effort. Tell your friends, grab a neighbor, reach out to your loved ones and encourage them to join you in getting your COVID-19 vaccination. In closing, Alabamians have endured a challenging 13 months. But folks, let's keep the faith. And as we celebrate Good Friday with Christians around the world, we're reminded that while all can look dark and discouraging, Sunday is coming. My fellow Alabamians, we will overcome the challenges and get through this together. So please have a very blessed Easter, and may God continue to bless each of you and the great state of Alabama. Now I'll turn the microphone over to Dr. Harris for his comments.
Thank you very much, Governor. Thank you all for joining us today. We appreciate you being here. It's very exciting for us to be here in Wilcox County. We're so grateful to General Gordon and to the National Guard for the work they've done. They've just been tremendous, and they have really helped us in our mission to try to get vaccine out, and particularly to get it out to the most vulnerable citizens in our state. Here in Wilcox County, Wilcox is about the first or second best county in the state in terms of percentage of people vaccinated, and we're very proud of that. We appreciate the support that we've gotten here locally for this clinic and for the other things that we have been doing. We're encouraged now that eligibility is opening up to everyone who's an adult, everyone 16 years of age and older. We believe that everyone ought to receive this vaccine. It's the way that Alabama gets back to normal. It's the way that we put all of this behind us. We're very fortunate to have 3 safe and effective vaccine products, and we are trying to get them out as quickly as possible. This week in Alabama, there will be more than 700 different locations that the state is supplying with vaccine, and additionally the federal retail pharmacy program has several hundred chain retail pharmacies that will have vaccine as well. So there will be multiple sites in every county in the state. And as we expand eligibility on Monday, we hope everyone will begin to make plans to get vaccinated as quickly as possible. We are expecting this coming week to have more than 160,000 first doses shipped into the state. That's by far the most we have had so far. Some of that is a one-time bump with some additional Pfizer and J&J product. I wanted to mention the J&J situation. As you know, nationally there were several million doses of J&J vaccine that were contaminated and had to be destroyed. That is not affecting our supply here or any of the J&J vaccine that has already been shipped out. Our supply this coming week is exactly what we thought it would be, and so we're very happy that has not had an impact on us at all. Again, I just want to thank you all for being here. Thank you for your support. We would encourage everyone here to go get a vaccine. Beginning Monday, every person here over age 16 is going to be eligible, and I hope you'll take an opportunity to do that as quickly as possible. Thanks again to Governor Ivey for her support. Thank you for what you're doing in your leadership to get us through this pandemic. At this time, I'm going to turn the mic over to our Chief Medical Officer at Public Health, Dr. Mary McIntyre.
Good morning, everyone. I just wanted to start by saying I want to first of all thank the people that are making this happen as far as with working together, the Alabama National Guard and all of the other folks that are actually assisting in those efforts. We've been working really hard from the standpoint of the very beginning of this pandemic to make sure that we were working with people in the communities to get things done. We've got a number of some great partners that have been assisting and helping, and we understand that there are still some barriers for some people to be able to access the vaccine, like transportation issues, potentially other problems with completing paperwork and other stuff, or even knowing where to go when it comes down to getting a vaccine. We're doing all we can to get the information out in as many forms as we can, from what I call the old-fashioned putting yard signs out, posters out, distributing flyers, using some of the community groups themselves, to working with churches to get information into their hands so they can get that information into the hands of their members and the community as large. We're open to recommendations and suggestions. We've been working with the historically black colleges and universities to see how we can pool and use some students, because as we move forward with vaccinating persons that are 16 and older, we recognize that we need to be able to reach that younger group population that, and you all know this, that believe that they're invincible, but it's going to be extremely important for us to get those persons vaccinated if we want to return to any semblance of normal. So that's why we are working with some of the community colleges and others to try to make sure that that message is out there. So you will be seeing additional info. You will be seeing information posted as far as with signs that are out there that's recommending and telling people to get vaccinated. And I just wanted to address one more thing before I stop. And that is that I have heard people with concerns about vaccine side effects. And let me just say this. That really means the vaccine is working. Your body is actually mounting the immune response it needs to mount. So if you get a little headache or you get a fever for a few days or some chills, that's it's not unexpected. And it may occur in some people and not in others. But that's not a reason to not take the vaccine. So I just wanted to mention that, because that's one of the biggest things that I'm hearing from my church members, from my family and friends. And what vaccine is the best vaccine? The one that you can get the first. I'm going to say that. So don't wait around for a vaccine of a specific kind and manufacturer to be available. Get the vaccine you can get in the beginning the soonest, because that's the only way we're going to beat this. And thank you all for all that you're doing, and continue to spread the word and get the word out. Thank you.
The Alabama National Guard is privileged to be able to provide shots to our citizens, and I want to thank Governor Ivey, Dr. Harris, and ADPH for their vision to incorporate us into this process and allow us to help assist our fellow citizens, which are our neighbors, because the National Guard lives and works in all the communities, and not all the people who are out here in uniforms are full-time for the National Guard. They have left their other jobs to come do this, and it's very much like we do with hurricanes, tornadoes, and ice storms. Whenever there is a need to help the citizens of Alabama, the National Guard is more than ready and willing to come do that. And to be able to do something this monumental that has such a significant impact on everyone in the state of Alabama is truly a privilege and an honor to be part of this process. And I just want to thank everyone through all the various state agencies, the local communities, the churches who have helped with this process and made it possible for us to do this, because it is so rewarding to help our communities, and that's what we in the National Guard do, and we're always ready and always there to do whatever our state needs us to do. So thank you for the opportunity.
All right, we've got time. Governor Ivey's going to open us up for just a few questions here. So,
Governor,
Lydia?
there are some vaccine clinics where there are hundreds of leftover vaccines. People aren't getting vaccines. For instance, in Tuskegee, they had 700 left over. Is the one reason why you're expanding eligibility because of vaccine hesitancy?
Dr. Harris? Yes, ma'am. You want to tackle that?
Sure, I'll be glad to. Thank you, Governor. We're expanding because we do feel like we have available supply. It's hard to know sometimes when we have shots that aren't given. Is that because there's hesitancy going on, or do we just have people that have access to care, who don't have access to our transportation or other means to obtain it, or maybe we just haven't communicated to them, that it's available. So it's a little hard to measure that, but clearly we are seeing, some open appointments. We're seeing some vaccine doses that we have available, and so expanding it makes sense to get it to the most people as quickly as we can.
Is there another question?
Governor Dr. Harris, CDC data recently ranked Alabama at the bottom in the country for the pace of vaccinations. Why is that? Can you respond?
Sure. All the states in the southeast have been at or near the bottom the entire time. We had a somewhat slow rollout at the end of December. We recognize that and wish we had done that faster. But since that time, our state's done a great job getting vaccine out, and so are most other states. And so in terms of being in that order, we're sort of where we started out. But we're very happy with the pace of things right now. I think all southern states are seeing some issues, perhaps around hesitancy or perhaps around just access to care issues. In terms of the percentage of citizens we have who've completed their vaccinations, we're not at the bottom at all. There are other states that we are ahead of, particularly here in the southeast. So we're actually very happy with the job we're doing right now.
And Kim, let me add that our number of new cases continues to go down, and also our hospitalization rates go down. I've certainly had both of the shots, and I'm proud to encourage everybody to get a shot. The best shot is a shot that's in the arm.
All right, any questions before we wrap up today?
Governor, this is a different subject, but Will Ainsworth announced today he was not going to run against you if you ran for re-election. Have you decided if you would run or are going to run for another term?
I sure can run. I'm eligible to run for another term. But right now my plate's full. We're busy getting shots in the arms, and we're busy working on the prison system and other major issues that have been long neglected in our state. So my plate's pretty full right now, and it's just not time to make that decision known.
Thank you.
Any other questions before we wrap up?
Okay,
Ken, final question.
Yes, better probably for Dr. Harris. It's 2 days until Easter. That's when normally we see the most people in church of any other day of the year, and a lot of family gatherings and restaurant eating. What is your word of advice for Alabamians to be careful not to protect themselves and others on Easter Day?
Yeah, Thank you for that question. We still want people to be alert, to be careful, to remember that the pandemic is not over yet. We still have a ways to go before we can put this behind us. For those people who are vulnerable, in particular, those people who are older or those people with chronic health problems, our advice still remains the same. Please be careful about getting together in groups. Please wear a mask when you're able to do that. Please make sure you're careful about sanitation and hygiene. I think, like all gatherings, you know, there are some rules that we try to remind people. You know, smaller gatherings are better than larger gatherings. Outdoors is better than indoors. A short amount of time is better than a longer amount of time. So please just do your best to protect yourself, and especially protect those most vulnerable people around you.
All right, thank you guys.
Thank y'all for coming.